Good evening. Well, COVID positive, it's a result millions of Americans are receiving daily. But now there's an antibody therapy that is meant to help prevent people from getting the virus. It has officially arrived here in Kern County. 23 ABC's Brianna Willis is at Kern Medical, where they started administering the medication. She joins us now live to give a better understanding of the therapy and what this means for you. Brianna.
Keely, Evusheld is a pre-exposure medication that's meant to help prevent those from getting COVID-19 that are immunocompromised. But local health officials say because of the limited supply, they're having a hard time administering it to people, and they also want to make sure that it's prioritized for those who are not eligible for a vaccine.
It's estimated there are about 7 million immune-compromised individuals in the U.S. Manufacturer made 700,000 doses. So how they decided to allocate the doses, and once it kind of trickles down to the county of Kern, there's a limited number of people who will be able to get it.
Evusheld, made by AstraZeneca, is the first and only antibody therapy under an emergency use authorization in the United States to prevent high-risk individuals from getting COVID-19. Dr. Glenn Goldis, Chief Medical Officer at Kern Medical, says their hospital is the only site you can receive the doses at in the county.
We were designated by the state of California to be the only site in Kern County to administer the treatment. And that's likely because we are a public entity, plus we are a safety net facility and have the capacity to perform the procedure.
Goldis says the two long monoclonal antibodies are administered as separate injections right after each other.
It actually works by inserting itself between the virus and the host, and it actually prevents the virus from attaching to a potential host.
But only those who are severely or moderately immunocompromised are eligible to receive the doses.
And what that really means is individuals who say have an underlying bloodborne cancer like lymphoma or leukemia, folks who have been in receipt of a transplant organ, such as a lung transplant or a kidney transplant.
Or those who are going through chemotherapy or high-dose steroids. And Goldis adds it's meant to protect those who need it most.
When you think about it, this is the highest risk population. They, for one reason or another, have an inability to mount an immune response to a viral load. And so if they were to become infected, they can get very seriously ill. This medication actually lowers their risk of developing symptomatic COVID by 77%.
Dr. Goldis says they've already given out about 20 doses so far, but to help prioritize those who need it most, doctors have to fill out a survey for their patients. Coming up at 6, we'll have more about the results from the first patients to receive the medicine. In East Bakersfield, Brianna Willis, 23 ABC News, connecting you.